Welcome to the Let's Talk About Food podcast, where I go into a deep dive on GI topics and questions you guys may have. If you're joining for the first time, my name is Dr. Islam. I'm a I'm a Mayo Clinic trained gastroenterologist trained at obviously the Mayo Clinic. I work at Lubbock Gastro and I take care of all GI issues. If you're new to this podcast, here's the format. I try to go to a deep dive on a topic, answer questions on that topic, and towards the end, I answer any live questions you guys may have as well. So if you want to answer a question for me, a couple ways you can get a hold of me. So number one, obviously come see me in my practice. Number two, send us a DM or a message as well. Or if you're interested in joining the live stream, I go live on my social media channels, YouTube, Facebook, Instagram, and all the social media channels around 7:30 p.m. or 7 p.m. Central Standard Time as well. Well, on today's episode, we have a couple topics I'll talk about. Number one, I want to reflect on Kate Middleton's quote-unquote diagnosis of cancer. We don't quite know what it is, and the rise of cancer we're seeing in younger individuals. We're also going to do a deep dive on fatty liver. We'll discuss exactly what is fatty liver disease, what are the symptoms, how do we diagnose it, how do we treat it, and on the very last segment, we'll talk about some of the questions you guys may have on the live stream as well. Once again, if you're joining me live, don't forget to smash that like button, like, share, and subscribe, and also let me know on the comments what questions you guys have as well. So let's go into topic number one, Kate Middleton. So you may have seen in the news last week where at the age of 42, she underwent some sort of abdominal procedure and was found out that she actually had cancer and she was going to get preventive chemotherapy. Now, obviously, I don't know what's going on. I'm not her doctor. No one am going to presume what her diagnosis is. We can have a guess based on what type of surgery she had. But what I'm talking to you right now is what we're seeing in the rise of cancer in younger individuals. So maybe 10 years ago when I started GI, it was unheard of to have a patient come to see me who was less than 50 years old. They were having concerns about their issues, about their bowels, their gut, their body, or even worried about cancer as well. And we have seen just this tremendous uptick in all sorts of cancers in people less than 50 years old, whether it's colon cancer or rectal cancer, which is what I see on a constant basis, esophageal cancer, breast cancer, ovarian cancer, endometrial cancer. We're seeing more and more younger individuals developing cancer, and we see this in a substantial number of patients. Now, the vast majority of cancers that we're seeing in less than 45 or less than 50 are in the colon and the rectum. But also there's been a rise in pancreatic cancer, breast cancer, and OB/GYN cancers in younger individuals. Why is this the case? This is a question that's been baffling us in the medical field for the past couple of years. It's even got to the point now where we changed the guidelines of when to get a screening colonoscopy from 50 to the age of 45. Now, there's a lot of speculation as to why we think maybe younger individuals are developing these cancers. We think it may be a combination of diet, environments, microplastics, who knows? But we do know that there is a substantial rise that's going on here. My personal theory is that it's a combination of all of the above. Let me explain in more detail. So, we do know that food and diet plays a role in our health. You know this, I know this. It doesn't have to take a medical scientist or a doctor to tell you that. If you eat like crap, you're going to feel like crap. You're going to get obese, have problems with your gut, problems with your heart, high blood pressure. Everything we're putting into our food affects everything that's going on. And we're seeing the results of this. All the processed foods and the foods that we've been making for the past 15 or 20 years since the advent of fast food is playing a role in our health. And because of that, we see a rise in obesity. We see a rise in hypertension, a rise in stroke, a rise in heart disease. And in my opinion, this is the reason why we're seeing a rise in cancers as well. We are what we eat. And I know for a fact that my patients who eat bad, they feel bad. And I'm seeing more and more of these cancers, especially colon cancer and esophageal cancer, and those individuals that are obese, that are big, and that don't have a good diet. We know that there's a change in the gut microbiome that's going on, and it cannot possibly be healthy for you or for anyone to eat the types of food that we're eating and expect us to live a normal life. So we know that's playing a role. That's one reason why I think we're seeing a rise in cancer. It's the hormones we're putting in, the processes we're putting in, the preservatives, things that make it taste good, the sugars, these things that add up, and over time, it's going to make a huge problem, and we're seeing this problem right now. The second thing is the environment. So we know that the environment that we're in right now may not be the healthiest environment. We have a lot of pollution going on. We have things in our water that we're not quite sure. The way that we're interacting with our phones, with technology, with some of the things we just don't know, I suspect this is also playing a role in terms of how we feel and in terms of what's going on in our body. Now, there's no good way to measure this. I can't do a test or a study to see how one person does with their environment versus something else. But that combination of the environment plus the food really is changing how we're interacting with our world than the way it used to be in the past. And then lastly, microplastics. So we're seeing more and more studies that microplastics actually have a significant role when it comes to the issues going on in our body and in our heart as well. What that role is, we don't know. We're just getting to the basic research of this, but I see in my patients this predominance of individuals who are prone to have problems with microplastics, who are developing issues later on in life as well. Now, once again, we don't have an answer. I don't have an answer, but there are things that you can do today to minimize your risk. So number one, if you're having any symptoms, any lumps and bumps, get those checked out. I cannot tell you the number of patients that come to see me who have the occasional rectal bleeding. We do a colonoscopy and we find a precancerous polyp. That bleeding saved their life because they would not have had their colonoscopy if they did not have that bleeding. Or somebody has kind of trouble with acid reflux or trouble swallowing, they came to see me for the same symptom. We found a precancerous lesion and we took care of it. Number two, don't forget to get your screening tests. If you are 45, get your colonoscopy. If you have a family history of prostate issues, breast issues, colon issues, make sure you get that taken care of. If you have a family history of cancers, find out why, what cancer, what age were they diagnosed. These are important questions for you to know so we can make sure we stay ahead of the game as opposed to behind the eight ball. Number three, change your diet. If you're eating crappy food, you're going to have a result that's not going to be good because of that. Change your diet. Go to more of a plant-based diet. Add in fruits. Add in vegetables. Have healthy fats. Have healthy nuts. Try to fast some time. These things have been shown to help you live longer and to decrease your risk for developing cancer. So do what you can for that. And then lastly, try to minimize the microplastics in your life. I've made an effort myself to try and do that. I'm trying to learn more about this, but the more you learn, the more you try and do this, the better it's going to be for your overall health. It is scary seeing a cancer in someone who is my age or younger. Recently, I've diagnosed multiple patients who are younger than me with both colon cancer and esophageal cancer. Don't ignore your symptoms, don't ignore the environment, and don't ignore what you're putting in your body. Make sure you can find a way to get that taken care of for you. All right, now let's do my deep dive now on fatty liver disease. What exactly is fatty liver disease? It's a very common question. So right now, fatty liver disease is the most common cause for the need for liver transplant and the cause for liver failure in the United States. It is scary what fatty liver disease is doing to the population. And so how do you know if you have that? The issue with fatty liver disease is that it does not cause symptoms until it's too late. Yes, that's scary, but there are certain conditions that I see that tell me you are predisposed to develop fatty liver disease. What are those conditions? So number one, if you're obese, especially if you have central obesity, fatness around your belly, there's a high chance you can have fatty liver disease. Number two, you drink alcohol. Alcohol is a direct toxin to your liver and can cause fat to accumulate in that liver and cause damage to occur as well. Number three, you have diabetes, or you have high blood pressure, or you have heart disease, or you have all of those. These set you up for develop problems in your liver as well. So if you have these conditions, what do I do as a liver doctor to see exactly what's going on? Well, we want to do a couple tests. Number one, we want to do some blood testing. I need to find out why you have fat in the liver. So what's important to me is the cause for the fat. And there are a lot of reasons why. Alcohol is one, obesity is another, but there are some genetic problems that can occur that can cause you to have fat accumulation or liver inflammation as well. So we do testing to see if you have that or you don't have that. Next, we want to do imaging. We want to see how your liver looks. Does it look normal? Does it look shrunk? Does it look big? Are there lumps and bumps on your liver? The imaging test will allow us to see what is going on in that liver. And then lastly, I need to find out, is that fat causing scarring? So what's important to me is that you have fat, but the cause for it, but is that fat causing damage or scarring in that liver? Because if it is, that can predict exactly how your liver is going to be and how closely we need to keep an eye on that liver. So let's say you've been diagnosed with fatty liver disease. What do I recommend as a liver specialist to get this taken care of? So number one, you have to stop alcohol. Not just diminish, you have to stop it. If you already have inflammation or scarring from fat on your belly and you're drinking alcohol, you're not doing yourself any favor. That ship has already sailed, and we do what we can to reverse the damage in that liver to make sure that's doing okay. Number two, diet and exercise is paramount when it comes to controlling what's going on in that liver. The best diet by far is a Mediterranean type diet. I actually had a patient come see me today and say, hey, Dr. Islam, I've seen so many diets out there for fatty liver. What do I recommend? I always recommend the Mediterranean diet. The data is impressive. It works. You add in vegetables, healthy fats, fruits, whole grains. You minimize red meats. This actually works out when it comes to liver disease. Next, you need to exercise at least 150 minutes of moderate exercise per week. You need to get this done. That exercise not only helps out with your body, helps out with your mind, it can help out with your liver and helps out with so many other conditions going on, whether it's obesity, diabetes, heart disease, GI issues, and things like that. So do that. Next, for some patients, you may want to consider vitamin E. Now, vitamin E is kind of a dual-edged sword here. There's been some suggestion it can increase your risk for prostate cancer, and there's some suggestion for some individuals it can make you die earlier. So take this with a grain of salt, with caution. Speak to your doctor. Next, incorporate the foods that can decrease inflammation in your liver. Black coffee, it's great. 2 to 4 cups of black coffee per day has been shown in clinical trials to minimize or decrease or reverse liver damage. So incorporate that black coffee into your diet. There's so many antioxidants that are there that can help out. Next is eliminate or minimize your peas. You know what I mean? Pizza, pasta, potatoes, potato chips. These things can make your liver work, so try to minimize your peas. And then lastly, for the love of everything, do not take a liver supplement. It doesn't matter what that supplement says, what you think it's going to do for you, it will damage your liver. Let me tell you a story of a patient of mine. I had a young patient, like 40-ish, who came to see me for liver inflammation. We did a full workup. We knew it was fatty liver disease. We ruled everything else. We gave her the diet recommendations, the lifestyle recommendations. But you know what this patient did? He ended up taking a liver supplement, because the supplement told him it would take care of his liver disease, it would detox his liver. And he ended up having liver failure from that supplement. I actually had to send him to get a brand new liver because he took a supplement to help his liver. Don't do this. We have stories after stories after stories of patients who took a liver supplement and actually ended up damaging their liver. So just make sure you don't do that. Now, lastly, we have a new medication that just got approved in addition to diet and lifestyle to treat fatty liver disease. We're so excited. It's the very first medication that's been FDA approved to treat fatty liver disease. And so we're trying to figure out in what patients to use this on, what insurances will cover it, and exactly how this role is going to play. So if you have fatty liver disease, come see me. We can find out what's going on. Watch my videos. We can do a deep dive to find out the true cause so we can get you taken care of. If you have the risk factors for fatty liver disease, come see me as well. We can do screening for you. We can see exactly what's going on and hopefully get things taken care of you. If you're interested in getting your liver taken care of, we are the liver specialists. Subscribe and watch my videos, and don't forget to come see us so we can find out exactly what is going on. All right, that was section number 2 there. So perfect. So let's go into some of the questions you guys may have as well, and let me see any deep dive, any questions on there. So one question that was asked, how can you prevent diarrhea with weight training? Well, it's a very good question, and I'm glad you asked this. Don't be embarrassed. So the question then becomes, why do you have diarrhea when you're training weights? Well, let me ask you, are you taking a pre-supplement? That may be it. The pre-supplements that people take have two main ingredients. Number one is coffee or caffeine, which is a stimulant for your gut. So that may be the reason why you're having diarrhea. So kind of watch your pre-workout, but also the type of protein that you take. I am very sensitive to protein myself. So I know there's certain proteins I can't take that cause me to have diarrhea. So the first thing I would check is make sure you're taking your pre-workout. What's in your pre-workout? Adjust that, change that, see if that helps out. Next, if you've done that and it hasn't helped out, try to see if you can increase the amount of fiber in your diet before you work out. So add in fiber to your protein drink or protein shake to see if we can hopefully allow you to get things better as well. And then lastly, sometimes you may need to take something like a Neodium to help out when it comes to slow things down and to also allow your bowels to help out. It's a very common problem to have, but the first thing I recommend is you change your pre-workout, see if that helps out, see if that adjusts some of the issues that are going on there as well. It's a great question that you asked. Perfect. So another question I was asked, hey, Dr. Islam, what are my thoughts on milk thistle? All right, this is very controversial here because I'll tell you for some individuals, it may or may not work. Let me tell you the objective evidence. So the objective evidence suggests that milk thistle can help out with some people and some individuals who have liver inflammation. Now, what I stress with this is that we're not quite sure if this is what the exact data says for this. We're not quite sure on that. I wish we had better data that can tell me taking milk thistle will actually help out with your liver. So let me tell you what I tell my patients. Milk thistle may be number 7 on the things I want you to do. So the first thing, stop alcohol, or minimize at least. Number 2, change what you're eating. If you're eating like crap, you're going to feel like crap. Number 3, add in coffee. Number 4, exercise. Number 5, consider going on a Mediterranean diet. Maybe number 6 and number 7, number 8 will do milk thistle. But don't do this first and not do the rest because that's not going to work. There's no easy way to get your liver taken care of besides doing the hard things. Now, if my patients do this and they want to do milk thistle and there's no reason for them to be on it, like they don't have a condition like cirrhosis, which would make me want to make sure you don't do that, then I possibly would recommend that in that patient. But it's very individualized. But I would tell you, do the first things first, get your stuff together, get that taken care of, so we can make sure that your liver is taken care of. They're doing good as well. All right, perfect. All right, good. Next question. Hey, Dr. Islam, I've had some pain in my bottom. What are some causes for that? So it's a great question, and I see this all the time. So not only am I a liver doctor, I'm also a poop doctor. So there are a couple of reasons why people can have pain in the bottom. Number 1, the first thing we check for is what's called a fissure, which is a tear in your rectum. Your bottom does not like paper cuts. No one likes a paper cut, but your bottom for sure does not like it. And when that happens, guess what happens to your pucker? It tightens up. And as it tightens up, it makes that paper cut worse. And then you get more tightening and worsening pain. It ends up being a vicious cycle. And so one of the more common reasons for rectal pain is a fissure. So we can diagnose it with an exam. We'll give you some creams like a nitroglycerin cream that can open up that rectum, allow the blood flow to go on there and resolve those issues. A second common reason are hemorrhoids. Hemorrhoids are dilated veins at the bottom that cause pain, bleeding, itching, and pressure. And you don't have to suffer from hemorrhoids. Certainly you can use over-the-counter topical treatments to help out, but we can get those hemorrhoids fixed. We do it in the office. It takes about 15 seconds to do. It's quick, it's easy, it's typically painless. We can get that taken care of for you. But also, rectal pain can be a sign of something going on inside that rectum. A common condition is called ulcerative colitis. Ulcerative colitis is a chronic autoimmune disease in which your body attacks itself to cause bleeding, diarrhea, but also rectal pain. It's called tenesmus, and that can also be a sign of ulcerative colitis. So in those individuals, if they have the right scenario, they have bleeding with diarrhea, we may want to consider a colonoscopy. And then lastly, don't ignore this. This also could be a sign of cancer. I've had a patient recently who came to see me who was having rectal pain. I did a rectal exam. She did have a fissure. It was very painful, but I felt something in there. So we went ahead and proceeded with a colonoscopy, and lo and behold, she ended up having rectal cancer. Now, luckily, we caught this early. We were able to diagnose her. But if you're having rectal pain, don't ignore this. Come see me where we can find out what's going on. hopefully do a further investigation and get things taken care of as well for her. So I'm glad this is a great question to do this. All right. So great question that was asked. Can you have liver problems but your labs be normal? It's an excellent question. And I'll tell you, these are the patients that are so difficult to know what is going on, because it's hard to really screen patients without doing imaging and blood testing on everyone. Most cases, if you do blood testing and you see elevation of your liver enzymes, then we can use that as a way to kind of see what's going on. But if your liver enzymes are normal, then you don't know. And so it's an excellent question, and I don't think we have a good answer. What I'll tell you is that if you have the risk factors for liver damage, or for example, you drink a lot, you're obese, you have diabetes, you have heart failure, you have high blood pressure, and you're worried, you may want to consider not only doing a blood testing, but also maybe doing some further imaging to see the scarring in the liver to make sure it's not scarred over. I have diagnosed patients with liver cirrhosis, of liver failure, that had normal liver enzymes. So you have to look at the whole picture to see what's going on and really piece together, do I really believe the lab, or am I going to treat you as an individual? And I would rather treat you as an individual, maybe do a little more investigation, even if it takes more time, to make sure I do the right thing for my patients. All right, next question somebody asks, hey, Dr. Islam, are there any supplements I recommend for your liver? So let me tell you my spiel on supplements, especially for the liver. Don't take them. Don't do it. It is terrible for your liver. I mentioned before, I've had to send patients for a liver transplant because they took a supplement. Now, if you're going to do anything, do things naturally. Black coffee, high fiber diet, no processed foods, minimize carbohydrates, consider milk thistle, consider vitamin E in the right setting. These are the only things that have been shown in clinical trials, in some clinical trials, to help out in some individuals, but not for everyone. So just kind of use that as a peace of mind, or a kind of a guide to see exactly what's going to be the best thing for you as well. All right. All right, guys. Well, I want to thank you for watching. If you want to learn more, if you want to hear more, don't forget to subscribe to my podcast. Give us a 5-star. Apple loves that. We're on Spotify, Apple Music. If you like what you're hearing, don't forget to go to my YouTube channel. And if you want to see me personally as your doctor, come see Slope Gastro so you can see exactly what's going on. Hopefully get you taken care of. I'll see you guys next week on our next podcast. Have a great and happy and healthy day.